You can hear me too?
Yep.
Okay. Hi guys, I'm Amy. I'm a PA at UW Hospital, Department of Surgery. I'm a plastic surgery PA. I do work with some cosmetic stuff that you think of when you hear plastic surgery. But I mostly work with breast reconstruction after mastectomy when women have breast cancer. We build breast tissue either from their abdominal fat, move it up, or put implants in. And then I also work with kids 3 days a week at the Children's Hospital with cleft lip and cleft palate and any skull deformities or congenital, meaning deformities that they've had since birth. So I work in the clinics only, but I have the option to work in the operating room with the surgeons and also on the inpatient floors, meaning when patients stay after their surgeries, they'll stay usually from anywhere from 1 day to a week after surgery, and so that would be an inpatient PA, meaning they take care of the patients while they're inpatient. I don't do that, but you can. So anyways, most people don't know what a PA is. Does anybody even know what a PA is? A physician assistant? Yeah, not a personal assistant. I make up things all the time when people ask what I am, they don't know. But does anybody know what a physician assistant is? I didn't know what it was until a couple of years ago. Well, before I applied, I should say. Okay. I should also say, this is very informal. You've been in school all day. You don't have to just sit there and listen. If you want to interrupt at any time, ask questions, say something, whatever, just do it, because this is more of a discussion than I don't want to just be lecturing. A physician assistant is just what it sounds like, an assistant to a physician. And I guess let's just get started, and then I'll tell you. So, yeah. Okay. So some of you guys have probably gone to the doctor and actually seen a PA, and you didn't even realize it. That's kind of how I realized what a PA was. I was going to the dermatologist, and then a year later I realized it actually wasn't a doctor, it was a PA. So we can do a lot of the same things that doctors do. So next time you go to the doctor, take a look and see if it says MD after their name or whether it says PA after. So PAs can practice medicine with a supervising physician above us. That's kind of the key to the whole thing. You are acting like a doctor, pretending to be a doctor, but you don't actually have to have all the responsibility. If you have a question or a concern or anything, just call up the doctor, and ultimately he's or she is the top dog. But exercise autonomy and medical decision making, that just means that we can diagnose and treat people on our own. That's what autonomy means. I don't know if you know. So we can actually see patients, diagnose them, tell them what's wrong, and then treat them. So we can order tests, we can order lab works, we can look at x-rays, CT scans, all that stuff. And then we can also treat the patient. We can prescribe, we can operate, we can send them to the physical therapist, anything that needs to be done. And then on the side, we can teach other PAs, students, to become PAs. I'm involved in a lot of research just because I work at UW. It's a teaching hospital, so we do a lot of research on the operations and the outcomes and then publish them in journals. So you can, if you're interested in research, but you also want to go into the medical field, a lot of people don't know if you are a medical provider, you can be anything. You can be a physical therapist, a doctor, a PA, a nurse, and you can still be involved in research, whether it's 1 day a week, half a day a week, or 4 days a week. A lot of doctors at UW actually do a lot of research and only see patients 1 day a week. A lot of people don't know that. So, I keep forgetting that I have control of this. So here's just pictures of what PAs can do. We can cast you up if you break your leg. We can stitch you up. That picture right there is actually me in Belize. I lived in Belize for 2 months and practiced family medicine last year. That was actually during PA school. But that guy had a cyst on his neck, so we actually just opened him up right there. In Belize, you don't have anything numbing. In the U.S., we would probably take you to the operating room or numb you up with some lidocaine or something like that. In Belize, you don't have anything, so that guy just sat there, and I just cut into his neck, took out the cyst, and sewed him up. So if you're interested in travel and medicine, that's also an option. My group of surgeons, we go to Nicaragua once a year and operate and do cleft lip and cleft palate surgeries on all the people in Nicaragua that don't have access to medical care. So if you like travel and want to combine medical, you can do that. You'll find, you guys, with the medical world, you can ease your way into a lot of things. If you want to put emphasis on research, you can do that. If you want to put emphasis on global health and travel a lot, you can do that. If you want to operate, you can do that. And if you want to operate, you don't only have to be a surgeon. You can be a PA and operate, and there's a lot of options. You can prescribe. You can write prescriptions. You can operate. You can deliver babies. You can look at x-rays. You can see kids in high school for their yearly sport physicals. I can't even. Any questions? Are you guys thinking, like, is there anything that we can't do? We can't do surgery by ourselves, I'll say that. We'll be like an assistant in surgery. So I'll never go in and do surgery on anybody, but I'll go in with my surgeon and we'll do the surgery together.
When you say assist, do you mean like you'll hand them things, or you'll go in and cut and they'll supervise?
We'll go in and cut in those. Well, they'll be cutting too. It depends on the level of, so do you guys know what the word autonomy means? No. Autonomy means the level of like independence that a doctor will give you. So right now, just starting off, I'm in my first year of being a PA for this group I work for 3 surgeons. And so when I did go into the operating room a couple times with them, I did minimal things because they don't know my skill level. I don't know what they're comfortable with. I cut, but they're standing right there. There's a PA that I work with that works with 3 different surgeons. She goes in, and sometimes the surgeon will like step out for a minute. It's not ideal, but if he has to step out, she carries on with the procedure, and he'll come back in. Does that answer your question? So, yeah.
As far as the diagnosis and the treating of the illnesses, does someone again supervise you, or are you just okay to go?
I'm okay to go and do it. Like along those same lines, you can admit patients to the hospital. You're given as much independence as you deserve, I should say. Starting off, my surgeons would never let me go in a patient room by myself. I would go in every room with the surgeon, so it would be like we were a team going in together. Once I kind of picked up on what they're comfortable with, what they like to do, I just saw, like my last couple of patients, one of them had a post-operative infection in their leg, in the wound site. So I just diagnosed them right there with an infection, gave them the correct antibiotic that they needed, gave them the number to the physical therapist so that they knew too, and then sent them on their way. If I'm concerned, like, oh, this patient has a history of a lot of infections and the surgeon needs to know about this because something might happen, then I will like write them a little note like, hey, I just saw this patient, just so you know they had this, but this patient that I just saw, no problem. They had an infection. I treated it. I don't suspect anything wrong will happen. The doctor has no idea that the whole thing happened. So it's kind of case by case. That's the beauty of PA. It's very flexible. It's kind of up to the doctor how he wants to treat his PA.
So is it like a pretty stressful job, would you say?
It's stressful in the sense that you can be responsible for a lot of things. But again, it's so flexible. I'm only on call from 9 to 5, meaning I have to be available by pager from 9 to 5 every day. But like today I left and it's fine. I'm not worried about anything. I didn't schedule any appointments. If anything comes up, they'll page me. I have some friends who get paid much more, but they're on call this certain amount of days. That's probably a little bit more stressful. But the satisfaction rates are higher. I have a slide coming up about the satisfaction of being a PA. So I didn't put it in. I didn't want to sound pompous, but I'll just say it. PAs for the last 3 or 4 years have been rated in I don't know what it is, Forbes, or there's all these rankings of careers. It's usually within the top 1 to 3 best jobs in America, based on Forbes 1000 or whatever it is.
What are the top 3?
I think dental hygienist has been up there, physical therapist. Do you know?
I don't know, but I think what she's trying to get across, and you can correct me if I'm totally wrong, is that she's getting a lot of responsibility in her job, so she's very well respected in the medical field, and she doesn't. And in addition to that, she is not like doctors go through a residency, and they spend the first could be 5 years of your employment life after you've gone to school for 8 years to become a doctor, that you spend the next 5 where you work 80 plus hours a week. And in her first year, she's working probably more than 40 hours a week, but she still has the flexibility to enjoy other things outside of her job, which is what a lot of other careers get to enjoy. People in the medical field don't always get that freedom.
Exactly. Let me show you guys a couple slides about what it takes to be a PA and like the whole process. Then you'll get an idea of maybe some of your questions will be answered, but feel free to keep asking questions. So you get the idea of what PAs can do. I'll just get off that. So why PA and why not nurse practitioner or a doctor, medical doctor? A lot of people choose to become a PA because patients are more satisfied with PAs. A lot of feedback I've gotten is that we can take more time with them. I spent 45 minutes with my patients today in each room, answering every question, talking to them for a long time, whereas the surgeon, if you get 5 minutes with the surgeon, that's a good amount of time. So physician satisfaction, we help physicians. We're like their little sidekick, I like to think of us as. So the physicians are usually satisfied to have a PA. Flexibility and practice choice, meaning we can choose any specialty that we want, and I'll expand on this in a minute, but we are not trained in one specific. I was not trained in surgery. I was trained in general medicine, as if it same thing as medical school, and then it's kind of on the job training as far as the plastic surgery part goes. Increased time for patient care, I already touched on that, and PAs used to be, we started in the 60s, 1965, something like that, and it was kind of looked down upon at first, but now it's just a booming career, and I don't have any threat to not. I graduated in May and started applying and had 6 job offers in 1 month. So the demand for PAs is high. It's not because I'm anything special. It's just the demand for a PA is out there.
Give yourself a little bit of credit. It's not like you were a poor student.
Well, I wasn't a poor student, but yeah. So the difference between a PA, is this what you're going to ask?
Yeah.
Okay. So some people think a PA, because it has the word assistant in it, is the same thing as a medical assistant. Medical assistant is somebody who rooms you. So when you first go to the doctor, somebody comes out to the waiting room and then brings you back to the room. They may take your heart rate, your blood pressure, your pulse, ask you what medication stuff and things that you're on. That's a medical assistant. That's 1 year after high school. You can go to MATC and get that. And then they also, I don't know if you ever see the little workstation when you go to the doctor's office, but there's all the patient rooms, and then there's usually a primary workstation where all the doctors, PAs, and nurses are huddling together with their computers. That's where we're organizing things. So if I go in and see a room and I need a record or something pulled up from the chart or something added, sutures removed, something like that, I go back and I ask the medical assistant to do that. That's what a medical assistant would do. A PA, after high school, you're going to go to undergrad, and then 2 years of school for PA programs, so that's 6 years total. However, if you go somewhere like Marquette, for example, has this option. If you go to Marquette for undergrad and then go to PA school as well, they'll combine your senior year of undergrad and your first year of PA school into one, so it would just be a 5-year course of school instead of 6. Also, PAs are trained in general medicine, so it kind of replicates medical school. You can think of PA school as medical school is 4 years, and PA school is 2 years. So you can think of same course of study of medical school, but throw out some of the extra stuff that is not as important and condense it into 2 years. Versus a nurse practitioner, it's the same amount of school. We're treated and we act mostly the same as far as Wisconsin goes. It's different every state. But in Wisconsin, a PA and a nurse practitioner are almost identical. However, a nurse practitioner is trained in a specialized field. They might be trained in pediatrics, they might be trained in adults only, something like that. Whereas PAs, I was trained generally, so I have the option. I work with both adults and children. And then a doctor, usually it's 4 years of medical school, 4 years of residency to specialize after medical school. And then if they want to do a fellowship or anything on after that, it's additional years. It could be upwards of 11, 12 years. But you are at the highest level of medicine. Do you guys have a question about the PA physician team and the independent? I skipped over that.
Yep.
That just means PAs and physicians are thought of more as a team. And traditionally, we could only work with the surgeon or the physician in the same building. However, that doesn't really hold true, and it's actually different from state to state. For example, this week, all 3 of my surgeons are out of actually the country, and I'm still practicing and seeing their patients. So it's not so strict as it was at one time. Whereas the nurse practitioner in the state laws, it says that they can practice at any time with the physician off site. They're not so much as a team. They work more independently from the get-go, and they don't always, I guess how I can phrase it, I was hired to be a PA under 3 doctors. If I was a nurse practitioner, I would be hired to be a plastic surgery nurse practitioner, and one day I may work for one surgeon and another day I may work for another surgeon. Does that make sense? It's kind of fuzzy because in other states I know that they're treated very differently. In UW though, in Wisconsin, PAs and nurse practitioners are the same. Just because of the state laws, there's no difference. One difference though, nurse practitioners can't go into the operating room. That's the only difference. The practice choice flexibility is what I was saying, that we're trained in primary care medicine, and then we have to take a test every 6 years to become recertified. So you become certified once when you graduate school. You pass a national test, and then you have to take that test, a different form of it, every 6 years to stay certified. So that being said, it's very easy for us to change specialties, which is I think the best part about being a PA. I graduated, I knew I liked surgery, I interviewed with general surgeons, plastic surgeons, urology surgeons, orthopedic surgeons, everything, and ultimately chose which group of surgeons I liked the best, not which specialty I liked the best. That being said, I'm in surgery right now. In 2 years, I may think, surgery is kind of boring. I wish that I was in the ER. I can switch and become an emergency medicine PA. So that's another thing. A lot of people like that because a lot of younger PAs are now choosing to be an emergency medicine PA. So a lot of my friends who are my same age are working late night shifts. We don't have kids. We don't have any responsibilities that we need to be home at 5 o'clock for. So they're doing that. But maybe in 5 years when they have kids and they're married and they need to be home at 5 o'clock or 3 o'clock, whenever, they'll switch to a job where they can be home at whatever time they need to be. Yeah.
Can you be a neurosurgeon PA?
Yeah.
You can.
Yeah, I have 2 friends who were just hired as neurosurgery PAs. And they both operate. They both go into the operating room. So there also is an option to do a postgraduate work if you're a PA. So that means after your 2 years of PA school, you do an additional year that would like specialize you. So I could do a postgraduate training in surgery. That would make me a better surgical PA. However, in my eyes, that just locks me into surgery, and that makes it so that if I down the road, if I do want to change to emergency medicine or family practice or something like that, it's going to be tougher to switch, and that flexibility kind of goes out the window. So that postgraduate education is actually new within like the last 20 years, and it's kind of controversial. It kind of takes away the whole point of being a PA, some people say. So where do PAs work? And these statistics are from 2009, but it's the best I could find that was clearly cut. It's about the same, though, I would say. 38% in the hospital, 35% in like a private practice clinic, which is where you guys probably go most of the time when you go to the doctor. And then a quarter of PAs choose to be in surgery. You'll notice that surgeons really like to have somebody by their side to help them. That's mostly because surgeons spend a lot of their time in the operating room, but when they're in there, they obviously can't be paged and say, this person is calling because they're worried about this. So it's nice to have a PA who's outside of the operating room who can be seeing patients while they're in the operating room operating. Does that make sense? That's why surgeons typically like to have PAs more than other specialties, but I think it's around 38% choose primary care, meaning like family medicine, where you guys probably go to the doctor once a year. OB-GYN is like women's health, or internal medicine is the same thing as family medicine, but it's for adults. And then 10% in emergency room, although that is increasing very quickly. For a while, PAs were not allowed in the emergency room, but now it's becoming booming. Every time I get an email I'm on a list that sends out new openings for PAs. Most of the time, 90% of the jobs that are openings are emergency room, and they're new positions. They're not like jobs that just have people quitting high turnover rate. They're new positions. So I suspect that emergency medicine percentage and urgent care also will be increased, more like the 25% for surgery. What do you think? Anybody have a guess?
Don't think it's a million. I think it is. $1,000.
No one can guess? 80. Yeah, that's about right. That's the mean. Or yeah, that is. However, I would say it's getting closer to 100, and the rate of increase of your salary goes up like 10% a year, I'd say. So it's a pretty high rate of increase. So that's just starting out. So
Half off anyway.
yeah, so I should say the lowest, when I was doing my job search last May, the lowest I saw was 74,000. And these are not only surgical, these are like any specialty across the board. And the highest I saw was 125. So
For starting off.
yeah. And a lot of it has to do, if you go into the operating room, you'll make more. If you are on call or have to take any weekend shifts, you're obviously going to make a lot more. That's about it. There's also, you'll notice on the websites, there's also websites that have list like which specialties make the most. So notoriously, emergency medicine PAs make much more than a family practice PA, just because it's more intense in the emergency room. You have to be on your toes a lot more. You have to be fast acting. Likewise, in surgery and orthopedic surgery, PA will make a lot more than a general surgery PA. I'm not really sure why, but it's always been like that. So, okay. So real quick, am I going too slow or this is good? Okay. How do I become a PA? Okay, so a big thing, I wish I would have put it in all caps, is get experience, meaning, I'll go into each point after this, but that's a giant thing for getting into PA school. So everybody is clear, first of all, that you need a bachelor's degree before you apply to PA school. So that means after high school, 4 years of college, or however long it takes you to get a bachelor's degree, and then you would apply to PA school. Yeah.
How long is PA school?
2 years. So it's 24 months, May to May. That's at UW. There were some schools that I interviewed out in Maine that were 2.5 years, but they got their summers off. So it just depends. If you don't want any breaks, you just do May to May, fly through it. And
Does it matter what your bachelor's is in?
no, so that's perfect. I got my bachelor's in kinesiology. Anybody know what that is? Exercise science. Because I was thinking about being a physical therapist for a long time, and so it does not matter. My classmates, I had history majors, I had art majors, I had any major art, anything you can think of. However, that being said, you can get your bachelor's in anything you want. All they care about when they look at when you're applying to PA school is that you have the set prerequisites, which the prerequisites to get into PA school is very similar to the same prerequisites to get into medical school. So your basic sciences, chemistry, organic chemistry, biology, physiology, anatomy, maybe I think Calc 1 in college, a psych class, and then a couple others. And you can, if you look on the websites, it'll tell you what basic prerequisites are. If you're more concerned about that, which I didn't include it because it's more of like when you're in college, you'll look at this sort of thing. But if you want to know, just go to the PA program website that I have listed there, and it lists everything that's needed to get into the UW PA program, which is very similar to, if you look at that website, you can assume that all PA programs in the nation will be the same because it has to be by law.
And those are all very similar for all science-related careers. You're going to take lots of sciences, lots of math classes, psychology classes, whether you want to be a science teacher or whether you want to be a medical doctor.
Yeah, I'm sure that Maggie and I took probably the exact same courses in college.
Probably.
And then
Make $80,000.
Then after your bachelor's degree, you apply. After you send in your application usually in the fall. This is for all schools. And then you usually apply to like 9 or 10 schools. I'll get into that in a second. Then you interview in the winter, usually around January, February. And then you go through PA school the following year. And then you take the national boards exam after PA school. And then you practice, and then every 6 years you take a test over. So, good question. So you can so they look for patient contact hours on the PA program application. But you can get really creative with this. So lifeguarding, I lifeguarded all through high school. That was like most of my hours. I also wanted to be a dentist all through college. So I think every Wednesday from 2 to 4, I went to my orthodontist and just shadowed him. Those were hours that I put towards it. I went to my dermatologist that I found out she was a PA. So I went and I shadowed her for, I think, like 2 or 3 months. And just, do you guys know what shadowing means? You just go and watch what they do, basically, shadow them. Yeah, then you feel like you're stalking them sometimes. Any volunteer work, I also volunteered at Meriter Hospital in the physical therapy department, and all I did was go into the patient rooms with the physical therapist and help them hoist up the patients or help them go through the exercises, or take the patients from the entrance of the hospital to their room in their wheelchair. And then, so that's not included as, well, maybe it is. There's this other thing that they say that you have to have direct patient contact, and that's where I put CNA, EMT, or a one-on-one caregiver, like a home health person. Do you guys know what a CNA is? Certified Nursing Assistant. I think you can go to MATC and get that, become a CNA from like 6 months of school, or 6 weeks, I think the program is. But you would work in a clinic, and you would, it's very similar to what an MA is, the person who rooms the patients. But you're doing very basic medical duties that I would say 80% of PAs or people in medical school or anything were at one time or another CNA. I'm very weird that I wasn't. Most people are at some point in their career a CNA. So if you look up what a CNA is, that's helpful. That being said, you don't have to be a CNA. I'm proof that you don't have to be. But it's a good way to get direct patient contact and learn basic skills of cleaning people in their areas that need cleaned, or just basic health skills. Were you going to ask something? Or no? Okay. Does that answer your question with experience? Okay. So also, don't freak out about the experience thing. Everything kind of falls into place. I would say do whatever you do, don't force yourself into getting experience. If you signed up for this volunteer thing at the hospital to work with a physical therapist and it's really boring and you hate it and you dread going every week or whatever, you should not do that. It's not like they're only looking for one certain thing. They're looking for a broad range of things. They're looking for well-rounded people. The things that I listed are sort of medically associated. They're associated with lifeguard is on there because you're learning how to save people's lives, do CPR. So it's kind of a stretch, but it actually is a very common way that people get experience. But that being said, all of my hours of patient care, like the physical therapy and the dental stuff, that all was just, the only reason why it happened was because I thought I wanted to be a dentist. So I thought, well, the only way I'm going to know if I want to be a dentist is if I go and pretend like I'm a dentist once a week. So I did that, and then after a couple of years, I realized I don't like this. I don't want to be a dentist. And then I thought at the end of that, well, I just wasted 4 years going to the dentist every Wednesday and helping him. What did that do for me? I'm not even going to dental school anymore. But in the end, it really did help because I used those hours towards my PA school application. So I would say follow whatever path whatever you're interested in, do that. And then if it can count as patient care hours, that's even better. Then go to college. You can major in anything you want. So here I listed some of the same things that I talked about, the core prerequisite classes that you should take. A lot of people though graduate undergrad and they won't have that zoology course or something. Then you could just end up taking that outside of college. Maybe I shouldn't even. Never mind. Forget about that.
Just do it. It'll be easier.
Yeah, just do it in college. Cheaper. Where can you apply? Anywhere. There's programs in every state except for the ones listed: Rhode Island, Vermont, Wyoming, or Hawaii. And if you just search like PA programs in the U.S., it'll give you a list. In Wisconsin, there are programs there's a small program in La Crosse. I think they have 20 people a year. Is that right?
That's about right.
Our program at UW admits 30 students a year. And Marquette has a much larger program. I think they have 60 students a year. And then Carroll just started. I think they're 1 year in. I didn't do the research really. I would suspect they're a smaller program, like 15 or 20 a year. Just to give you an idea, the year I applied to the UW PA program, we had 9,000 applicants. They narrowed it down to 430 for the interviews, and then they admitted 30 people. Sorry about that. So it is competitive, don't get me wrong, but it's worth it, and it's very doable, and I recommend it. Okay, so what's it like? It's 2 years. So the first 12 months of PA school is all in the classroom. It's long days, but kind of like what you're used to here, 7:30 to 5, and it's very fast. I think in college you typically take, 12 to 15 credits a semester. In PA school, it's like 28 credits a semester. So it's very, very heavy load. I think that I went out to dinner maybe twice in 2 years.
Yeah, I didn't see Amy in those 2 years.
No, it's like a lot of things happen, so you're going to miss a lot. But if you think of it but it is doable. I have classmates who are in their 30s who have 2 kids and a husband and a normal life and household that they have to keep up, and they went through PA school and did it. So, I mean, it's doable. I'm not trying to scare you at all, but I'm saying that you have to be very dedicated, very committed, and okay with the fact that those 2 years of your life are probably going to fly by you, and you're probably going to miss a lot of things, but it's worth it in the end. 2 years and you're done, and then think about it. The second year is just like medical school when the students are out. I don't know if you guys go to UW clinics, but when you do, a lot of times there's a medical student there or a PA student. So you're just going and you're basically shadowing, in a sense, a doctor for a year. You change clinics and hospitals once a month. So you kind of live out of your car for a year. Kind of gets annoying, but you see a lot of Wisconsin. Meet a lot of cool people. Okay, so didactic means in the classroom. So this is in the classroom schedule. So this was summer, and then this was our fall semester, spring semester, and then the second summer, and then the clinical year. We just don't listen to the word preceptorship. Doesn't matter. We were in a bunch of different clinics for this whole clinical year. So this is probably more information than what you need to know, but what I wanted you to get a sense of was, number one, the course load that you're going to be doing, but number two, you can see how it's like a class in every every specialty that you need to know. So it's very much set up like medical school. It's called it does the medical model is what they call it. Whereas nurse practitioner school does not follow the medical school model. They have their own, their schooling is very different than what this is. Job satisfaction. I already told you that it's an awesome job, but 80% of PAs were satisfied with the amount of responsibility. So some days I'm like going crazy. Get to the hospital at 6:30 a.m. I don't leave until 6, and I sat down for 5 minutes to eat lunch. But other days, like right now, my surgeons are gone. I see the patients that call in and need something. I saw 6 people today, and the rest of the time I was in the office getting people ready for surgery in a couple weeks. So I would say my amount of responsibility is great. Also, I'm responsible for a lot of things, but at the same time, if I need help or I feel like I can't handle something, I've always got somebody I can call. That goes along with the support, the job security. I'll knock on wood, I guess, but I don't think I'll ever have a problem finding a job, switching a job. Working hours, I work regular 9 to 5. I know I said I'm sometimes going at 6:30, but that's for a lecture that I like to go to. But other PAs, like I have 2 friends who work in urgent care up in Minneapolis. They work 3 days a week, 12-hour shifts, and make 30% more higher pay than I do. So it's completely different, and the working hours are completely different. I was looking at a lot of jobs that were 4 days a week, 10-hour shifts. I work regular 9 to 5, Monday through Friday, but it's totally flexible so that if you have kids or a family and down the road, maybe I'll want a job that I do only work 3 days a week. It's doable. Task variety, you can do clinics, you can do operating room, you can do inpatient hospital, you can do ICU. ICU is intensive care. Salary, obviously, is a big thing. Fringe benefits. So anyways, in comparison, PAs were more satisfied with than other health professionals, including physicians and nurses. I think that's the last slide. Yeah, and then there's the websites, but they're on that handout, and I can give you guys them. Okay, so I don't know if sorry, I did not practice that. I don't know if that was more information than you ever wanted to know, or what. Thanks. I think these websites are actually really helpful, but PA is not a foreign word to Google, so it's pretty easy if you Google about this stuff. But also, I did leave my email address down there, and I encourage you, email me anything you ever wanted to know. I think my job is the coolest